Welcome back, everyone. With all the talk of mask use today, we thought we'd better get a good idea of why and when you should wear one.
Dr. Amy Kahn, the medical director for Regence Blue Cross Blue Shield, is with us this morning with more in our Healthier Together segment. Thanks so much for joining us, Dr. Kahn. You know, this is such a divided issue. We have, folks who are adhering to the guidelines, they're wearing the mask faithfully, and then you have folks on the other side of this argument that say this is overkill. What do you say?
Well, since the advent of the pandemic, we've learned so much about COVID-19 transmission. And for most people who are infected, they're asymptomatic or pre-symptomatic. However, these individuals can still spread infection to others. And so cloth face coverings can be helpful in reducing the spread of infected droplets that might be generated through speech or coughing or sneezing. So we do know there's some science behind this. There was a meta-analysis, an examination of over 170 articles that looked at these precautions, and a subset of them looked specifically at face masks. It showed that the odds of transmission were greatly reduced, over 80%, when people used face masks. So we know that this can help in that decreasing transmission, particularly in a setting where we're seeing more and more people diagnosed with this condition.
I think some of the hard part was in the beginning, we were told that face masks weren't necessary, but as you mentioned, information has evolved and we know a lot more. So what do we know now about when we should actually wear a face mask, most important times?
Excellent, Carrie. And yeah, I think initially there was some concern about the availability for those most essential healthcare workers, but now we know that a simple cloth mask can actually be protective. And the settings in which to wear those would include public places, going to stores, waiting in lines, going into crowded areas, whether that be indoor or out, public restrooms, right? Places where there may have been other people, shared spaces, whether it be an elevator, a shared cubicle, say at the library, or a shared workstation. And we also know that there are opportunities to wear these masks when you're using public transit, right? Whether it's a bus, a light rail, you're taking a shared ride service like Lyft or Uber. These are places where it's important to wear that mask, particularly when you cannot assure being over 6 feet apart from another person.
Dr. Kahn, for a lot of folks, wearing a mask can seem kind of foreign, a little strange. And so what are the ways that we should be wearing them, the proper ways? I've seen folks wearing masks and sometimes it's not covering their nose.
Exactly. Well, proper fit is really comfortably covering the nose and the mouth and then secured by loops around the ears or tied in the back of the head. And I think it's important to recognize this is a little bit like getting fitted when you get in your car and you're fitted into the driver's seat, right? You need to adjust the seat or the tilt on the wheel. You need to find a mask that is comfortable, that fits your face, and that in particular you can take off and wash, being careful not to touch the front of it, right? There are loads of options out there. Home sewn versions, you've got fancy online models. The important piece is that it's comfortable and you can wear it.
Dr. Kahn, such good information. We appreciate you talking with us this morning. Hopefully that cleared up a lot of questions that some of our viewers may have about wearing a mask. Thank you.
Thank you so much, Carrie. Stay safe and stay well.
Fox 13 and Regence Blue Cross Blue Shield of Utah would like to help answer your health questions. Send your ideas or your questions to us at healthtogether@fox13now.com.